Hi, good afternoon. This is your County Executive Ed Day. I want to thank you for joining me on the latest COVID-19 update we have. I'm going to be very honest with you going out. You're not going to see me doing a lot of smiling today because I know my friends and neighbors out there are not smiling right now. So let me get you up on the numbers. Then we'll go into that vexing issue that we're all facing right now, vaccines. First, the numbers, the latest numbers. And please keep in mind the data is publicly available on our COVID-19 dashboard, which you can access through our website at rocklandgov.com, rocklandgov.com. And before I do forget, I would urge you, when you're trying to access the state website, make your life easy and go to our county website and use a link to wherever you want to go in the state site. The state site is difficult to navigate. I found that to be true myself. So I would urge you to do it that way. You probably have a better shot at getting through that way than you would in any other manner. As of yesterday, there are 2,910 active cases of COVID-19 here in Rockland County. That means people are testing positive. Many are asymptomatic. It does not mean serious illness or fatality. So I'll be clear about that. Active cases, like I said, are confirmed positive cases within the last 2 weeks that have been reported to the Rockland County Department of Health. The number has been steadily increasing since the end of the summer, and I'm going to show you a chart here. The predicted second wave is here, but we are ready for it. And here is the latest. I'll try to get this up. John, help me out a little bit. I do have John Lyon, my communications director, guiding me here. Okay, so over here is the high point. The high point right now is 2964 on January 11th. As you can see, it's been steadily increasing from December 26th. We had a little bit of a downward trend for December 9th, but now we are still on the upward trend. On August 18th, we had 82 cases. That was down. That was when we had knocked down that first wave. So again, these cases are not necessarily people who are seriously ill. They are people who've tested positive. So we do track this, so we understand what's going on, because one of the most important and critical issues, if you heard me talk about before, is the hospitalization rate. That is also a measurement from the state as to what they're going to do next in case the hospitalization rate increases. Right now, we're hovering about 100 people hospitalized since the end of December. The good news, if we can find some here with what's going on, is that this week it has dipped back down to around 80. That's a significant cut. That's a 20% reduction in hospitalizations, which is a heartening thing to see. Either way, and the most important issue is well within the ability of our local hospitals to handle, and that is a critical piece for us to know. That's important for everybody in case we do get sick. We want to make sure we have a bed. That said, we recently passed some very troubling milestones when it comes to the numbers. According to New York State, there have been 30,770 positive COVID-19 tests here in Rockland since the beginning of the pandemic. And we're about 10% of that number, which makes us a significant piece of the situation, which is going to get us to that vaccine issue a bit later on. If each test was from a different person, like I said, it equates to about 10% of the population here that has grappled with this deadly disease. And it's taken a terrible toll. 805 people, our friends, our neighbors, our loved ones, have died in Rockland from COVID-19 related deaths. That is 8 times the number of Rockland residents killed in the attacks on September 11th. Think about that. I ask you all to take a moment to pause with me in a moment of silence in their honor and solidarity with their friends and families who must go on without them. Thank you very much. Now, on to the latest frustration that we were all facing, getting vaccinated. First of all, let me say that I hear you and share your frustrations and worries. My office, our health department, other county offices, our town offices, village offices have been inundated with your phone calls. We are doing our very, very best to help. But we have more plans. We have more plans in this regard. First of all, for any of the seniors who may be watching, we are in need of assistance with this process. Please call our Office for the Aging at 845-364-2110, 364-2110. They will try to assist you, especially if you're a bit limited when it comes to dealing with computers and smartphones. I think John has something to offer. John?
Yeah, just to jump in there real quickly and respond to something that came up in the chat. In addition to helping out our seniors, they're also able to help out anyone with an impairment, visual impairment or otherwise. They're a good resource to go to help people through this process.
Right, and we have plans and to try and make this a little bit easier for our seniors and also for our disabled members of our community. I think we speak about that later on, but that is in the works right now. Our director, Tina Cardoza-Izquierdo, and her staff will do their best to help you find an appointment and one of the few sites that do have the vaccine. Also, before I forget, John, if you would make a note, there also is assistance for our veterans, I believe over 75 years of age. That was on my Facebook page, so if you do have Facebook, which you're hearing it now, you will, but later on you'll be hearing a link, and that's for folks who don't have Facebook. There'll be an email blast going out tomorrow morning. So John will put that up on the comment section of the website of this broadcast. So those who are veterans, those who serve this country in service and protection to us, will have an ability to be able to get assistance separate and apart based upon their veteran status. To begin with, let's get some things very clear. This is a state plan. It is owned and operated by the state of New York, not the county of Rockland, not any of our 5 towns, not any of our 19 villages. The state has taken full control of the core part of this process. That includes the website that we are all forced to try and navigate. It also includes who gets the vaccines, what locations are open to give out the vaccines. Our local health department, who has been skilled and battle tested, they've gone through this with the measles. They and other health departments train regularly on mass vaccinations. They are the subject matter experts, and they have been largely ignored by the state. The state has gone off and made their plans. They are entitled to do so, but when it comes out the way it's coming out now, they're to be called out on it, and this is what we're doing here today. We're showing a little transparency to what is going on, because it's important, because it frustrates me when I get phone calls, my staff when they get phone calls. We're thinking, feeling, and loving human beings. When we hear people in stress, when I see these emails coming from people who are in a near panic, just trying to get some assistance, getting blocked out of the website, it troubles all of us. It troubles all of us. So I just want all to understand that. But right now, the governor wanted to own this, and now he does. So we're trying to make it work. I want people to understand we're not merely pointing a finger. We're trying our darndest to make this work the best we can, but we need help, and we're going to get into that as we go along. Let me tell you right now, what's happening right now with the vaccine distribution is absolutely unacceptable. There's no other way of putting it, and I think if there was some level of honesty in Albany, they would acknowledge it too. They need to stop blaming the federal government. We do get, and again, I'm not going to get into the feds and the state. That's their issue to deal with. My issue to deal with is the state of New York as the next overhead command, such as it were. They're the ones who give us the vaccines. That is who I'm dealing with. I'm not dealing with the federal government. That's what the 50 states do. Last Tuesday, Rockland County Department of Health received 1,000 doses of the Moderna COVID-19 vaccine. They administered every dose to eligible individuals before the end of the week. In 3 days, they administered 1,000 doses. 3 days. We have the skill set, as I said earlier. Seeing how quickly and efficiently we're vaccinating, because remember, we had laid these plans out well before the first shipment came in, and now we actually were testing it for real. We tested it prior to that. Now we're testing it under real-time circumstances, and our health department performed admirably. So with doing that, we requested 2,000 doses for this week, feeling confident we could vaccinate 400 people a day at our clinic at the health department of Pomona. We have the location, we have the parking, we have the room to do it, and that's without a mass vaccination center. We're able to do that. Unfortunately, New York State saw fit to send us not the 2,000 doses we asked for, and that we could dispense. We got 200, 1/10 of what we asked for, 200 doses. And here is the worst part, to show you what we are dealing with. And what we are dealing with directly affects you. And that's why we're sharing this with you. It's not a blame game. It's not an excuse. But I want you to understand when you read things, when you see things, I'm about transparency. I'm not a lifelong politician. I get fed up with the nonsense that we hear by too many of them. But you know what we deal with, you'll understand why certain things happen as they do. When the 200 arrived, we were informed a couple days earlier that we were getting a shipment. We were informed by UPS. We were told we're getting a refrigerated shipment. Now, we guessed it was obviously the vaccine. We didn't know how much it was. We had no one who we could call to find out how many vaccines were there for obvious reasons. We want to be able to prepare and get ready people to come in and get the vaccine. If we know how many vaccines we have, we can start off by preparing the vaccination center. Well, guess what? We knew the shipment was coming. No one in New York State could tell us how much we were going to receive, and it made it nearly impossible for us to effectively plan and schedule. So our health department opened up the appointment system once we knew we had those 200 vaccines when the box showed up, and the appointments were booked within 15 minutes. Understandable. Again, there was no opportunity to work through this in a more conservative manner. Every dose was administered to every eligible individual by the end of the day on Tuesday. I want to take a moment here to applaud the team of the health department. They are battle tested after our measles outbreak and have trained every year to perform mass vaccinations. We know how to do this effectively, and we want to be more engaged and involved in service to all of you. The issue we have is that New York State has not provided us with the vaccine to do the job. It's as simple as that. When people ask me about opening up mass vaccination centers, great idea. In order to do that, we need something to vaccinate people with. We are nowhere near that right now. Getting 200 doses, and also my colleagues in Putnam, Dutchess County, Orange County, we're all part of the same Mid-Hudson region. They are seeing 200 and 300 numbers when it comes to getting a vaccine. So they're in the same boat. So please believe me when I say that I am frustrated, as you are all in this process. Being that I am over 65 now, I am eligible, but I have not yet been vaccinated. That is something I am not going to do right now, because the reality is I am waiting until there's a ready supply for everybody who are at risk. And I figure I'm a lucky guy. I'm 69 years of age. I'm in fairly good shape. I have no compromised immune system. So I'm going to get the shot, because I think it's important that the leader of the county do that, set an example. But I'm not going to get in front of someone who has a dire need for this vaccine. That I will never, ever do. So I want to assure you that when we receive more vaccine from New York State, we are ready, absolutely ready, to expand our efforts to the degree we are allowed to by the supply. Last month, our health department submitted our mass vaccination plan to New York State. This was before any vaccines were delivered anywhere. That is what we do. Again, this is something that I will share with you. On my staff, my deputy county executive and my chief of staff are both retired lieutenant colonels. I will share with you that they were intimately involved in this type of operation overseas. So they know how to get this done. So they were part of the plan in conjunction with the health department to make sure we get this done and get it done right. I will tell you, my chief of staff was very clear when he saw the plans from New York State. He had sincere and significant doubt it would ever work out. Turned out, sadly, he was correct. We supplied provisions for mass vaccination. One of the locations was RCC in the field house. Some of you have actually sent me a message like that. But we also did a dozen other sites around the county. So we submitted all those plans. We were ready to go. Now, weeks later, we hear and read the state is making pronouncements that they're going to look at mass vaccination sites as if it's their idea. Think about this for a second. Go into what we did and why we did it before the first vaccine was delivered. That's what we did. We did it because we want to be prepared, not after it. So now, what the state is doing now is looking at mass vaccination sites, and now they're also looking to add pharmacies and other locations. This is akin to preparing a plane in mid-flight. There's no other way of putting this. These are all things that should have been done at the very beginning. Things that Rockland County did, things that Orange and Putnam and Dutchess County did, All these counties had plans laid out because their health departments were similarly skilled to ours. They knew what to do, but they had been excluded. And we repeatedly told the governor's people in this control room, we want to be more engaged and involved. We're here to work with the state to get the job done in service to the people of our respective counties. So here's what happened. By doing this, by looking for major new sites, new pharmacies, different locations, you are increasing demand with an unchanged supply. You're not adding the amount of vaccines to this. You are basically increasing demand. Also, you're expanding the eligibility of various groups. We were at 75 and over, I believe, John. Suddenly, out of nowhere, we went from 65 and over. Now, I understand the pressures that are being brought to bear on the governor. We all deal with that as executives. But you can't fold to pressure. It's just not viable. It's not workable. And again, what happens? You've increased demand. Now we have 65-year-olds and over running to trying to get the vaccination, and the supply is still unchanged. This is a recipe for I'm going to say disaster, but it certainly is a recipe for a frozen effort. It's not going to go anywhere. We have other agreements in place with some of our local providers and municipalities to assist us with staffing and resources. So again, in short, we are ready. We're just looking for the ability to help out, and we need the vaccines in order to do that. The only thing we lack right now is a consistent and equitable supply of vaccine, whether that be measured by county basis, or if you measure it by population. When you look at the eligible people who will be getting this vaccine, it's not the whole population, obviously. Either way you look at it, I'm going to be very clear, this is mathematical, and these are numbers I'm using that the governor has shared, so it's not like I'm making these things up. Either way, we are being woefully shortchanged, and that, my friends, is unacceptable. When we presented the facts during our weekly call, and this is something else that John understands, got me really lit up. We have a weekly call with the State Health Department, New York State Health Department, and we brought these facts forward. The response that we got on that phone call, which was muted so he couldn't respond back, was that we are lucky we're getting any vaccine. How arrogant is that? That is arrogance at its finest. How dare you say something like that to elected officials and people in health departments who are trying to do the right thing by the people of this county? It is unacceptable, and I will not tolerate it. But I'm going to close today with this one promise. I will not stop fighting for the people of this county, nor will I quietly allow for New York State to ignore the plight of our residents. That is not going to happen. I know I'm probably going to get some flack for this broadcast today, and frankly, I don't give a damn. I really don't at this point. We need sites distributing vaccine right here, not over the Tappan Zee Bridge, and not in New York City. And I'm going to tell you another story. A friend of mine is a retired police captain. He was on WRCR radio a couple of days ago, and he went on the website. He got through. He got the "Are you eligible?" section done, and he got a piece of paper. He printed out. It said he's eligible. He made an appointment in the Bronx. Went down there. Everything worked out fine. Half hour or so, he was finished. Came back home. How in God's name do you have people from Rockland driving to the Bronx, and we don't have any availability here in Rockland County? That goes back to what I said earlier. There is a serious inequity here. I am not looking to be politically popular here. I'm looking for fairness. I know the governor is trying to work out whatever they're trying to work out as far as supplies are concerned. Again, I don't care. I want fairness. I want absolute fairness. So everybody, getting sick and dying is not something that any one particular group of people have a corner of the market on. We all get sick. We all die. And I think it's fair when you look at a county that has had one of the most significantly impacted counties in the state of New York for COVID-19, nearly 10% of the infections. We should be up in the front of the line right now, period. Stop with the political niceties and do the right thing here, because frankly, I am fed up right now. It's time for New York State to follow through with its promises, to promise to equitably distribute the vaccine and send it directly to Rockland and other localities around New York. Not across the river to Westchester, not out in Long Island somewhere. I heard it was the last one. Send them here to Rockland County so our people have a shot, especially the folks who are older, have a harder time moving around. They have a shot at getting it without having an accident without falling or tripping or having a difficult time beyond what they have to put through. Like I said, we are among the hardest hit counties in New York State, and we, with over 800 loved ones, our neighbors, our friends, who are dead from this dreaded virus. I am demanding a response from the governor commensurate with what we are dealing with here in Rockland County. We need, and I'll make it clear, we deserve a minimum of 2,000 doses delivered immediately. That is my ask at this point of the governor and the State Department of Health. And I'm going to ask all of you to help, because I actually got questions on Facebook. You know, people are posting on social media. Yeah, more needs to be done. So I'm asking each and every one of you who is concerned as I am about the people in this county, about ourselves and our loved ones and our friends. ny.gov. ny.gov. That is the New York State website. You can communicate with the governor there. And all those questions you've been sending to us, you've been sending to our supervisors, our village mayors, because of not knowing, well, now you know. Now you know where the questions should be directed to. Demand change, demand action, demand attention, demand to be treated fairly, demand what you have a right to have a state government that responds to you in times of need. We in Rockland County are here to assist. I have said this many, many times. I will implore the governor, fix this problem. There are unnecessary deaths and unabated. All this is going to do is bring delay and confusion, and that is something neither he nor I want to see. So I would say simply to the governor at this point, and share with you, let's work together and get this done. Get us the tools. We are happy to go forward and do what has to be done for the people of Rockland County. And I can share with you, again, my colleagues in the region and elsewhere in the state also feel the same way. So I will leave you with this thought. I know it's difficult. We are going to be, again, we have not been on Facebook Live for a while. We'll be doing this again regularly as long as this new crisis has developed, the crisis of shortages of vaccine. I mean, no, I don't think we'd ever thought we'd be saying this, but we will be on until things moderate, until we see that this function has improved, and that people are getting appointments with some ease, maybe some difficulty, but some ease also, and that people can again believe in a system that they are going to get the medicine they need so they can protect themselves from this disease. So be patient, folks. So I'll ask you to do that. I'm trying to be patient. I have my team around me who calm me down every day, because I can get lit up very quickly, especially when my neighbors and friends are affected. So I will be there for you, but I will tell you this: we will get there. We will get through this. I've been saying this from the beginning. So we're right on the precipice of the end of this dreaded pandemic. So let's stay together. Let's work together. Again, your voices count. Let the politicians in Albany understand that. Your voices count. Make them heard, whether by messaging or by phone calls. With that, I'm going to bid you adieu. Have yourself a wonderful evening, and until next time, this is your County Executive Ed Day signing off. Good night.